of Ldl and 6.
Yeah.
Oh, excellent. Thank you very much for your help.
Okay, just tell me when to go to the next slide.
I have to tell you when I want to change.
Yes.
Yes.
That's
So
the next
I
slide.
should like to speak about the possible role of antioxidants per free oxygen radical rate in cells on early prevention of all chronic inflammatory illnesses of young people. Next one, please. What are the causes of oxygen stress? For example, free oxygen radicals, which is produced by everywhere, or lipid peroxidation and other oxidoreductive processes. The result of this will be a damage of tissues in vivo. It was written by Lars Elster in Chemicals. Lars Elster was the first who wrote it in the last century from Sweden. He was the professor of biochemistry of the Swedish University. Next one, please. What are the protective mechanisms which was written by Professor Elster? The antioxidants, it is maybe preventive or maybe chain breaking, vitamins, trace elements, enzyme products, phenols, urate, and aromatic amines, and serum HDL cholesterol peroxygenases, which was only written a little bit later, maybe at the end of the last century. Next one, please. What are the answers of our cells during the oxygen stress? Production of different inflammatory factors to the circulation, especially if not enough the antioxidant capacity. The next one is the frequent repetition of the oxygen stress without enough antioxidants in childhood and adolescent ages may cause some chronic illnesses, for example, atherosclerosis, or some malignancies, not every malignancies, but some malignancies, inflammatory bowel disease, IBD, or others in the very early adulthood, which is started in childhood, but they cause disease in the early adulthood. Nobody wants to tell about this. If we want maybe speak about the chronic illnesses of the old people, it is absolutely other. We speak about the chronic illnesses of young adult people which start in childhood. Next one, please. I should like to speak about the atherosclerosis, which was my scientific work since about 30 years ago. The first one, the role in the development of early vessel damages, LDL oxidation of formed cells and so on, which was written by Goldstein also in the last century. The role in the destruction of plaques, it was also written in the first decades of this century. Next one, please. Which was the first mechanism. The oxidized LDL internalized by macrophage faster, causes decrease of tissue macrophage movement, endothelial cell deformation, and increase of PPAR depending transcription, smooth muscle cell proliferation, and FOR, increase of heat shock proteins antibodies. Next one, please. Regarding to the second mechanism, if FOR as mediator of tissue damage after ischemia, high oxidized LDL content of plaques, and positive correlation between oxidized LDL and occurrence of both coronary heart disease and plaque damage. Next one, please. What are the results which suggesting protective role of antioxidants, if possible, to go there to the cells. A higher CHD frequency in population with low total antioxidant capacity. A higher atherosclerosis frequency in population with low selenium level. And patients with CHD had lower superoxidismutase enzyme activity. Next one, please. Antioxidants was given for patients as a cure with CHD. It happened, what happened after? It happened a decrease of the mortality rate, which was expected. But the biggest CHAOS study, when A-vitamin monotherapy was given, found no any expected results. It was written in the Lancet in the last century. The cause may be the too late application. Antioxidants may be useful only for the prevention and not for the treatment. Next one, please. What happened when, what give us a possibility for prevent infections and others in the early prevention? Oxidized LDL caused endothelial damage. It was inhibited by selenium. Chromium caused a decrease of serum LDL cholesterol level, increase of serum HDL cholesterol level of patients with NIDDM, diabetes mellitus, was caused by chromium. Next slide, please. What was our data which supported the role of antioxidants in early prevention? We saw a decrease of TBARS in high-risk children. We wrote it in the Atherosclerosis. This was written in 87. This atherosclerosis is periodics in the United States. Support the effect of the diet in children with familiar hypercholesterolemia. It was written in the Journal of American College of Nutrition. Body mass index and systolic blood pressure of obese children decreased by dietal and physical exercise treatment, but pathologic oral glucose tolerance test was normalized only by if we given some antioxidant supplement. It was written also in the Journal of American College of Nutrition. Next one, please. What are the consequences? Antioxidant therapy given patients with CHD or some malignancies failed to cure these patients because the therapy was started too late. However, the preventive effect of these materials given to children or adolescents with high family risk seems to be useful, showing the importance the oxygen stress antioxidant rate in the cells for the prevention of young adult chronic illnesses. Thank you very much for